Afternoon, my name is Amy Muniz, and this is our Tay-Sachs disease presentation. We are Group C, which includes myself, Amy, Desiree, Irvin, Heather, Tariq, and Catherine. Going on to our first slide, which is description. Tay-Sachs disease is a disorder that destroys nerve cells in the brain and the spinal cord. The child may look normal during the 3 to 6 months range. They have good health, but from there on after, they will start experiencing slow development. The child's muscles will weaken. They'll start to lose their motor skills. Not only that, but the child will start experiencing seizures, hearing and vision loss, and paralysis. Children who suffer from Tay-Sachs disease typically live into their early childhood. Going on to the next slide, which is cause. Tay-Sachs disease is caused by a defective gene on chromosome 15. This defective gene makes it so the body is left unable to produce a protein called hexosaminidase. Unfortunately, if the body is unable to produce this protein, then a chemical called ganglios starts to build up in the nerve cells of the brain and then destroys the brain cells. This disease is a genetic disorder that is passed on from both parents. Although this disease can be carried by anyone, it is much more common among the people of Ashkenazi of the Eastern European Jewish descent. 1 in every people of the Ashkenazi Jewish descent is a carrier. Going on to treatment, there is no specific treatment for Tay-Sachs disease, but there is standard therapy and investigational therapy. So we first have standard therapy, which is treatments that serve the symptoms and the conflicts within the disease. So we first have nutritional support, which kind of involves the feeding tube to help the children eat. And then we have anticonvulsants, which is for seizures, kind of helps monitor them and reduce them. And then we have the basic pediatricians, neurologists, audiologists, eye specialists, and counseling for the child and the parents. And then we have investigational therapy, which is treatments that are still being observed and experimented. So we first have gene therapy, which is when the defective gene is replaced with the normal gene, though there is some technical difficulties with this experiment still. And then we have chaperone therapy, which are small molecules attached to a new hexosaminidase, trying to get like the hexosaminidase to perform normally. And then we have the enzyme replacement therapy, which is replacing the missing enzyme in those who lack it. And then we have a medicine, which is pyrimethamine, which has shown increased activity in the hexosaminidase, though this drug has not shown a significant change in development. And then we have our prognosis. Unfortunately, even with the best care, the average lifespan for a child with Tay-Sachs disease is about 4 to 5 years old, usually from a recurring infection. There is no form of treatment that can slow down or stop the progression of the disorder, but the main priorities for doctors is to kind of keep the child comfortable until eventually their death. But by preventing complications, managing symptoms, and managing infection, one can increase their quality of life as much as possible. And then we have some strategies for parents and teachers. Noting that there is no known cure for the disease, it is important that the child gets support from the family, the teachers, and just everyone around them. It can be hard for parents to cope, but we do have some support groups that we found, which is National Tay-Sachs, Allied Disease Foundation, and March of Dimes Foundation. And then we also found that working with genetic counselors to provide support and coping strategies is kind of a really good way to kind of find those strategies, learning how to support the child and kind of keep them safe. And then we have parents should provide the child's teachers with information on Tay-Sachs and kind of work with the teachers, the nurses, the principals to just make sure that the child is getting the proper care. So this would include like providing a specific treatment guide for the teachers and nurses. And then lastly, we have our references. If you have any questions, just let us know. But this is the end of our presentation. Thank you for listening.